All right, so for this lecture, we're going to take a little bit of a look at the conditions that can happen when we have issues with either a hyper or hyposecretion of both the adrenal glands as well as the pancreas. So the first disorder that we can end up with, which is hyposecretion of the adrenal cortex glands, is what's referred to as Addison's disease. Addison's disease can cause a couple different things. It can cause a bronze coloring of the skin, which essentially is referred to as hyperpigmentation. And then we can see a slew of symptoms that we can get from that. So people with Addison's disease have severe fatigue. They usually can lose weight without really trying to do it, or they'll have what we call unintentional weight loss. A lot of times they have gastrointestinal problems, things like nausea, vomiting, as well as abdominal pain. They can be lightheaded and often can have fainting spells. They seem to crave salt, and they also have muscle and joint pain. So think about this. If we have hyposecretion of the adrenal cortex hormones, we're looking at hyposecretion specifically of the mineral corticoids. All right, mineral corticoids would be that salt craving, and we could also have a hyposecretion of the glucocorticoids, so we don't have as much blood sugar in the body. So we end up with this kind of fatigue, as well as the possible of lightheadedness. Lightheadedness usually is due to low blood sugar. Right. Here's a slew of them over here. Well, in the diagram here. So the big thing here, low blood sugar, again, because of the decrease of mineral corticoids, so we're not absorbing water as well as sodium as well. And then all of these other ones usually happen because of just the not enough of the blood pressure and things in the body. Fainting can also be because of low blood pressure, because the mineral corticoids help us retain that blood pressure. So if you stand up, you get that real quickly. You stand up, you get that little bit of lightheadedness. That can be caused because, again, we just don't have enough volume in the system. So we have low blood sugar as well as pressure. Okay. Another one we get is hypersecretion of those adrenal glands. So now think the opposite direction here. So we have all of these mineral corticoids and glucocorticoids in the system, but there's no purpose for them. All right. So in these cases, now we have weight gain, not only because of the increase in glucose in the system, so the body starts to store it as body fat, but we also have an increase in water retention. So we end up with these kind of disorders. Obesity would happen because of that. We also get what we refer to as a moon phase. So that's this girl up here at the top. You can see before she developed this Cushing syndrome and then after she developed this Cushing syndrome. So you get this kind of very rounded appearance of the face. You usually get what's referred to as a buffalo hump. This is this really large kind of deposit of both fat as well as fluid on the back portion of the cervical and upper portion of the thoracic spine. We'll usually get stretch marks because the person is gaining weight a lot faster than they normally would, and plus they have this huge fluid retention, and they tend to bruise really easily. So they have a lot of these small kind of ulcers on the body or kind of bruising because of those different things. And again, this would be hypersecretion. So now you're getting way too much of the mineral corticoids as well as the glucocorticoids. So the mineral corticoids are causing the body to retain all of this water and not really get rid of it. All right. And also the glucocorticoids are causing the influx of glucose into the bloodstream, which is going to cause a lot of these problems to happen. Okay. These are going to be for the adrenal cortex for the sex hormones. All right. So you can masculinization, which usually happens because of the androgens, specifically for females. This would cause an increase in testosterone. So the thing that's kind of not known as well is that both men and women, because we have these adrenal glands, we both secrete male and female hormones. In most cases, because the males are secreting enough testosterone, they suppress that androgen effect. They suppress that the female hormone, okay, the estrogen. But in females, the same thing is happening. So they're producing enough estrogen to suppress the male hormone, testosterone. But if we have a hypersecretion effect, they're producing way more of the male hormone than they normally would be. So they end up with a couple different things. So they end up with facial hair, and they can also end up with male pattern. They can end up with patterning of body hair. So they'll end up with kind of a beard, usually hair around the face and jawline, as well as a sort of a mustache. Right, and they tend to have more body hair than because of that testosterone production. For males, again, because if even with an overproduction of estrogen, testosterone still can over affect that. But there can be cases where you can have males who have a hyposecretion of estrogen, that can start to have some female quality. So they start to produce somewhat of breast tissue. They start to put on more body fat because as the estrogen is overpowering a little bit of the testosterone, but usually it can be masked a little bit because you don't see it. Right? These are then going to be associated with, the last couple here are going to be associated with the pancreas itself. So there's a couple different types of diabetes we can have. We can have diabetes mellitus. All right, there are two types of this. Symptoms of this could be polyuria, so going to the bathroom quite often, polydyspia, right, respiration rate, and then acidosis. So a couple different things we can see here. This is type 1. Type 1 individuals are insulin deficient, meaning they don't produce their own insulin. So they are the individuals who have to give themselves insulin shots daily to control their blood sugar. Most often, these are patients less than 20 years old, because most often they have this diabetes mellitus, this type 1 diabetes from birth. This is an autoimmune disorder where the B cells in the body are actually, of the pancreas, are actually destroyed. Remember, these B cells are what are producing insulin for us. So if we don't have them, we can't produce it. You can get what's called hyperglycemia, so an increase in blood sugar levels, right? And that's bad because a couple different things will happen. So the cells can't use the glucose. So in this case, fat is actually broken down for energy instead of glucose. All right. This causes what are called ketones to be released in the body, resulting in a condition called ketoacidosis. This is actually a type of weight loss that some people try to do. So they eat high levels of fat, low levels of sugar to create this ketoacidosis effect in the body, to kind of supercharge their metabolism, they think. The problem with that, though, is you're lowering your blood pH, right? Lowering your blood pH can take care of or damage other tissues and organs if this is continued for long periods of time. And then this will usually result in death. All right. Complications that can ensue, they can end up with what's called atherosclerosis. This is the hardening of arteries as well as the filling of fat tissue inside of them. Congestive CV failure. Okay. You can end up with gangrene. This is usually because of the damage of tissue caused by the lowering of the blood pH and the acidic nature. People with type 1 diabetes usually develop cataracts because the tissue inside of the eye can be affected as well. Interesting, it's kind of side note, most issues specifically to do with diabetes can actually be caught in the eye, because these retinal vessels in the back of the eye are more sensitive to this type of an issue. So your eye doctor might actually catch the fact that you have diabetes where before anybody else does, because usually we go see our eye doctor at least once a year. Treatments for this, as you can see here at the bottom, we have an artificial pancreas. So usually we can use some sort of an insulin pump or things on the outside that can detect the rise and fall in blood glucose levels. And then the pump itself can actually administer the insulin on its own, or these individuals have to give themselves insulin shots and check their blood pressure regularly. We're starting to find out that we can actually do somewhat of a transplant of the pancreas, as well as beta cells, but this is kind of in early trials. They've actually, a newer one that I've seen a little bit of some research studies on is they're working to use a virus, right? I know we're talking about viruses in general of COVID right now, but what they can actually do with a virus is they can take out the genetic material, the RNA that's in the virus, and implant their own genetic material. So scientists are trying to use a virus to actually inject the correct sequencing that would allow the pancreas to produce insulin. All right, so they can inject that directly into cells, cause these B cells to be developed, and then the pancreas would start to produce its own insulin. But that's really early stages. These are most of the ways that we try to treat that currently. All right. The other one you can get is type 2 diabetes. Type 2 diabetics are usually people that are over 40 years old. They're usually overweight. They have high blood pressure. And the problem usually is with the receptors on the target cells, so specifically on the body cells themselves as well as the liver. These people usually have a really bad diet. And then the only really way to control this is there is medication that can be given. There's a medication called metformin. Metformin works as to control and help these cells, these target cells, uptake glucose. Or the other way to control it is to simply do it through diet and exercise. All right, that's probably one of the easiest ways to do it. This is just another kind of look at this. So this is the healthy process. All right, we have a release of insulin. Glucose then can bind into the cells. All right, with type 1, there is no insulin, so glucose can't go into those cells or bind and get into these cells. And in type 2, the glucose binds, but for some reason, the insulin receptor that's supposed to be there on the cell fails. So it doesn't allow that receptor to work. So then there's some of those other medications that we were talking about, specifically metformin, can be given. It helps open up this receptor site, and then the person can absorb that. Okay. All right, we'll go ahead and stop there.